Goni skill, knee flexion. Position the patient supine with the knees in extension. Make sure the hips are in 0 degrees of extension, abduction, and adduction. Place a towel roll under the ankle to allow the knee to extend as much as possible. In patient-appropriate language, ask the patient to flex the knee while you assess the femur for rotation, abduction, and adduction of the hip. Hold the patient's ankle in one hand and stabilize the anterior thigh with the other hand. Allow the hip to flex to 90 degrees as you move the knee into flexion. Stabilize the thigh to prevent further motion at the hip. The end of range of motion occurs when resistance is felt and further motion causes additional hip flexion. Assess the infill of the joint, which should be soft because of the contact between the muscle bulk of the posterior calf and the thigh, or between the heel and the buttocks. The infill may also be firm because of tension in the vastus medialis, vastus lateralis, and vastus intermedialis muscles. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the lateral epicondyle of the femur. Recall the technique taught in class to identify the lateral epicondyle. Align the stationary arm with the lateral midline of the femur using the greater trochanter for reference. Again, utilize the technique taught in class to identify the lateral epicondyle. Align the movable arm with the lateral midline of the fibula using the lateral malleolus. Ask the patient to perform knee flexion as previously, maintaining the goniometer in alignment through the entire range of motion and observing for any extraneous movements of the hip. Read the degrees of motion on the goniometer and then ask the patient to return the leg to the starting position. Remain at eye level of the goniometer while reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion according to the American Association of Orthopedic Surgeons is 135 degrees.